Sometimes children engage in behaviors that are concerning to parents, such as throat clearing, vocal tics, and finger crossing. It is essential to seek out the proper medical and/or mental health professionals to address problematic behaviors, especially if a child is taking a prescription medication. In this forum, we can provide some examples of how to determine what may cause or trigger the behaviors and provide strategies to reduce or interrupt them. Let's start with a closer look at a simple ABC chart. You can request that the school team complete this over a few days to determine any patterns or triggers. A teacher or paraprofessional marks what happens right before the behavior in this column. Writes the behavior here and what happens after the behavior in this column. Let's say behaviors are more likely to occur when the child is asked to complete math problems. The teacher can chunk the work into smaller segments by folding or cutting the paper, or by writing short breaks throughout the paper. This often prompts the child to work to the break, redirecting and reducing anxiety. An example of an interrupt strategy is to give the student something to do with his hands when excessive finger crossing occurs, such as helping to pass out papers. If he is throat clearing, ask him a question you know he could answer. It is important to not draw attention to the behavior, as these may be involuntary. Taking a closer look into the possible function of behaviors will help the educational team develop appropriate academic and emotional supports for your child. For further information, visit thewatsoninstitute.org.